Today, we're tackling a massive, real-world bottleneck that is literally stopping artificial intelligence from fully taking over your medical care. We hear so much about these incredible, almost magic-like technological advancements in healthcare AI, right? But today, we're zeroing in on the ultimate hurdle. When things inevitably go wrong, who actually takes the legal medical blame?
So let's dive right into it. If an AI doctor makes a mistake, who gets sued? This provocative question perfectly captures exactly why the legal stakes for clinical AI are just so incredibly high. Because look, it's not just about whether a computer can logically reason through a problem. It's about what happens when that reasoning completely fails. If an AI misdiagnoses a critical illness, who's left holding the bag? That single question is the absolute anchor for our entire discussion today, and honestly, the answer to it is going to determine exactly how far medical AI is actually allowed to go.
Now, what's really wild is just how fast this tech has evolved. We've gone from needing these perfectly structured codes and clean database fields to having AI models that can literally read the messy, unstructured narratives of doctors' progress notes. Think about it. Earlier decision support systems were totally rigid, but so much real-world healthcare actually exists in stories, right? Referral letters, consultation records, discharge summaries, and these newer AI models, they're now capable of interpreting all that free text, giving them a much more complete picture of a patient than we have ever seen before.
And hey, this isn't just some far-off science fiction either. Narrow, tightly controlled forms of autonomous AI, like screening for diabetic retinopathy, have already crossed the line into active clinical practice today. We actually have authorized systems out there right now that can look at a specific medical image and make a screening decision without a human physician having to review every single result. But, and this is a big but, we have to remember this is an extremely narrow boundary. We're talking one disease, one type of image, one specific task. It is definitely not a general-purpose AI doctor diagnosing whatever walks through the clinic door.
Because here's the catch. Recognizing a statistical pattern on a scan is definitely not the same as understanding a patient's financial limits or, their family concerns. Which brings us to a really core issue. Medicine is far broader than just picking the most likely diagnosis out of a textbook. Two patients with the exact same condition might need completely different treatment plans based on their age, caregiving responsibilities, or just their personal preferences. A machine might know the math for sure, but that complex, humane judgment required to apply that math safely, that remains uniquely ours.
Let's move to Section 1, the pivot, the liability bottleneck.
Because when a system lacks that vital human context and something goes wrong, the fallout isn't just a simple technical glitch, it becomes a profound legal crisis. You can't just stand up in court and say, hey, blame the computer. Think about this for a second. If an AI misreads a scan and the doctor signs off on a faulty treatment plan that harms a patient, the responsibility fractures into this terrifying web. Does the blame fall on the treating clinician, the hospital? What about the software developer who coded the algorithm, the vendor, or maybe even the regulator who approved the whole thing? Without a crystal-clear accountability framework, clinicians are going to seriously hesitate before trusting AI with high-risk decisions.
And it gets trickier, because AI isn't a tool you can just approve once, put on a shelf, and forget about. There's this serious phenomenon known as model drift. Imagine cramming for a massive test, only to have the teacher completely change the textbook overnight. That's model drift. The environment around the AI changes constantly. New diseases pop up, documentation practices shift, medical devices are upgraded. If the AI model stays frozen in time, its accuracy actually decays. So healthcare regulators face this really tough balancing act. Developers need to update models to fight the drift, but those updates have to be rigorously tested so they don't accidentally introduce brand new legal liabilities.
So how do we prevent these AI systems from tossing out incredibly confident but totally unsupported medical suggestions? Well, clinics have to build a gating process where the AI is strictly bounded by approved, auditable clinical standards. Basically, we need a trusted source of truth. Instead of just asking an open-ended language model, hey, what should we do with this patient? The safer, legally defensible question becomes, how does this patient compare with the evidence-based guidelines our human clinicians have already approved? That keeps the clinical authority exactly where it belongs, with the healthcare organization.
And to pull that off, we have to completely ditch those mysterious black boxes and move to a glass box approach. We need to ensure doctors can trace exactly why an AI made a suggestion and clearly identify any uncertainty. A lot of AI systems today get heavily criticized for spitting out answers without showing their work. In healthcare, that lack of transparency is just a massive legal hazard. A glass box approach gives doctors an actual audit trail. They need to see the exact data reviewed and the rules applied. The pathway has to be understandable enough for human professionals to review, challenge, and ultimately take legal responsibility for.
So essentially, healthcare organizations are going to have to digitally credential these AI systems, pretty much exactly like they do with human doctors. They need to walk them through rigorous, step-by-step governance checks before ever letting them touch real patient records. I mean, you wouldn't let a clinician practice without checking their qualifications, right? An AI tool absolutely shouldn't get unlimited access just because it looked really cool in a tech demo. Organizations have to define the exact task, designate the overseeing human clinician, and pinpoint exactly when the system has to escalate a complicated case to a real person.
Oh, and this credentialing, it has to be hyperlocal. We have to remember that a model that works absolutely perfectly in a massive, bustling urban hospital might completely misread the demographics or workflows of a small rural clinic. You just cannot assume a model proven in one environment is going to perform identically in yours. Little differences in language, disease prevalence, or local treatment guidelines mean an off-the-shelf AI could make some deeply inappropriate recommendations. So to avoid taking on catastrophic legal blame, you've got to use local data to test the system before it ever goes live.
So with all these massive liability risks hanging over our heads, what is the smartest early use of medical AI? Well, right now, it's acting as an incredibly efficient administrative assistant. It's about helping overextended care teams draft responses and triage issues without ever making independent diagnoses. Healthcare workers are just flooded with patient messages about test results and follow-ups. AI can safely step in to help organize all that communication, maybe flagging a message about worsening symptoms for immediate human review or summarizing a really long medical history. It reduces the workload dramatically without crossing that dangerous legal line of actually prescribing meds or finalizing a diagnosis.
Moving on to Section 2, the collaborative care future.
Ultimately, the future of healthcare isn't about replacing human doctors at all. It's about collaboratively extending their reach. A successful integration of AI won't be measured by how fast we can remove professionals from the loop, but by how effectively AI can support them in providing safer, faster care while the human experts maintain total clinical authority. So, as we wrap up this explainer, I'll leave you with this final provocative thought to chew on. As this technology continues to absolutely soar, will we ever truly trust a machine enough to take the ultimate legal blame for our lives? It's a question that goes way beyond coding and data. It cuts right to the absolute core of human accountability.